Good morning. As I sit here with you today, I'm excited that New Jersey has passed 1 million people that have been vaccinated with their first dose. That is a tremendous success in the amount of time since we began vaccinating in the middle of December. I anxiously await word as to whether or not we're going to get our doses this week and be able to fulfill the 13,000 people that we postponed. We were down to just 2,000, and I'm hoping that indeed we'll be able to have enough doses to complete those individuals and then open our appointments again. Again, that link will be on our website and will be pushed in our social media platform, so you can find it there. We had 200 people sign up for our town hall this week or attend our town hall. We did provide a lot of information about the vaccine. Unfortunately, most of the questions that people had is, where can I get one? And I understand the anxiety around that, and we're going to continue to partner with you to help make sure that anyone who wants a vaccine will get it. You just may not get it when you want it, but we are committed to making sure that we have access in our communities in South Jersey, and we will partner with you until the last person who wants one gets one. I want to talk to you a little bit about mammograms. We've seen a 50% reduction in the rate of individuals who we've diagnosed with stage 1 breast cancer. That doesn't mean that stage 1 breast cancer individuals have gone away. It means that they've stopped getting their mammograms. And we need to really encourage people to do it. Now, there are a whole bunch of things that have been told about the vaccine and mammograms, and whether you should or you shouldn't. The requirement, or the suggestion, I should say, is that if you haven't had your vaccine yet, it's probably better to go ahead and get your mammogram now. But even if you have already had your vaccine, like I have, I'm due in March. So I'm going to go ahead and get mine, because nothing's more important than that. And I really do encourage the women who are listening today to make sure you get yours, and the men who are listening to make sure the women in your lives get their mammogram. And of course, we have those appointments available, and we encourage you to come forward. Today, I want to also spend a minute talking about our history. Dr. William King was one of the first African-American physicians who was led onto the Underwood staff in Woodbury. Now, that could be the end of the story, and I could tell you in 1968 everything goes forward, but it doesn't feel right not to tell you that it required the NAACP to get involved in order for him to receive those privileges and file suit. Now, obviously, we're proud that we've moved along past that, but it wasn't that long ago. And you know, Dr. King was somebody who, as a child, knew he wanted to be a doctor. He trained as a physical therapist first, went on to get his DO, and then came to Woodbury. And the stories of Dr. King's history are so moving. You know, they talk about the fact that he would do house calls. They talk about the fact that he'd work till midnight. They talked about the fact over and over again that it was Dr. King's deep commitment to making sure that everybody had access and that everybody was important. Dr. King's memory is something that we will continue to hold on to and continue to remind ourselves that we must do better, and that we must ensure that everyone who wants to be a physician or wants to be a nurse and wants to practice has that opportunity to share their skills with us at Inspira. And speaking of sharing skills, I just have to tell you this amazing story that happened this week. I was in Elmer to celebrate the fact that they had won the Women's Choice Award for highest patient safety and highest orthopedic and OR patient safety. There was another celebration. There was a celebration of tremendous heart. Tommy is one of our volunteers. He's 30 years old, and he rides his bike to the hospital every day. And there are a group of people that have all gathered together and decided they were going to raise money to give Tommy a new bike and buy those other things that he needed. And everybody had a tear in their eye and tremendous gratitude, because this is what makes us different. Yes, we're a healthcare provider. Yes, we take care of thousands of people. We've vaccinated almost 27,000 people. We've done all these wonderful things. But it's that one-on-one interaction that makes the difference with our patients, with our volunteers, with our community, and, you know, quite frankly, with our history. The amazing gift is that you continue to walk with us during our journey to be the best healthcare provider we can, so that you and we can have the benefit of all of the gifts, all of the people like Dr. King, all of the volunteers like Tommy, and all of the staff who give their skills and their heart every single day. Thank you for allowing us to be your trusted partner. Thank you for all of the gifts you give to Inspira. And until we meet again, stay well and be safe.